Hello, everybody. Good evening. It's good to be with you guys today. The webinar is titled "What You Need to Know Before Going into Egg Donation." So probably if you're now at this point of your journey, there are a lot of treatment cycles that you have gone through, or probably not, but you're in a point in where you feel that the way you're going in terms of the options that you have tried before to achieve pregnancy haven't worked. And well, you're probably exploring this option, which I consider personally it's a very good one. Um, to be honest, the first thing is for you guys to know that you're not alone, and that this is a very common route for treatment, especially because, well, nowadays, probably you guys know better than me that couples are delaying quite a lot maternity, and finally they end up in a stage in where the ovarian reserve could be already too low. And well, this is an option that is available. And if we take in mind um, here in fertility clinics, out of the pregnancies that come as a result from treatment in ladies that are over 43 years old, I would say like a kind of a common cutoff. I think that the vast majority of these babies come out of egg donation programs. So the reason why I consider it is a good option, it's because usually first there are three things mainly. One is that success rates are very good. If we take in mind that success rates go between 60 and 65%. So that is a very good success rate if you compare what it could be possibly when you're over 38 years old, or when you're even over 40, and where success rates in an IVF or in an ICSI treatment are sometimes even around 15%, or in some specific cases even lower. So this is the first advantage. The other one is that the time is not against you. This is the other thing. Of course, we have some age limits because of regulations and legislations. But at the end is the same thing to go over an egg donation treatment at this point. Let's say, for example, you're 41 years old, and to go with the same type of treatment when you're 43. I mean, the success rate, if you get older, as long as your uterus and your uterine cavity is in good shape, the success rates will be the same. So that is another advantage that probably takes out pressure out of you. And then the other option is that the other advantage is that usually the treatment that you need to go through and all the steps are a lot simpler, because when you're doing fertility treatment with your own eggs, when you're doing IVF or ICSI with your own eggs, you need to go over first stimulation. Then after this, you need to go over egg collection, and you need to, during the stimulation, have ejections, and then after the egg collection, wait for the embryo culture, and then have the embryo transfer. While when you're doing egg donation, what we need to do basically is to prepare your endometrium to receive that embryo. And to do that, the type of treatment is a lot more simpler, because you're just going to receive oral medication to prepare your lining. And after 10 days, 2 weeks, we will verify that your lining is in good shape, in good thickness, and then you would just need to start progesterone and then come for the embryo transfer. So at the end, the process in where you are involved in the amount of medication and all that is a lot less. So this is the third advantage. I know that probably the reason why there's a bit of reserve with this option is because, well, at the end, technically, this baby that's going to be born doesn't have your genetic charge, but you know, this is something that if you look at it objectively, at the end, going over maternity and being able to uh, give nutrition to a baby that's developing in your womb and feeling how it moves and seeing how this baby is born from you is already something that is quite important. And I would say that nobody can deny that this baby won't be yours. And probably, yeah, it's not going to be totally genetically yours, but biologically, I would say that definitely it will be yours. My experience along these years doing reproductive medicine, I have 16 years doing this in this field, and I've seen the journey of couples going through treatments without success sometimes, and at the end deciding for this option. And once, well, this pregnancy comes and this baby is born, um, all the things that passed are just erased, and now there's just the joy of having this baby that was um, desired for so long. So I would say that it's a very satisfying route at the end, and it has a very high chance of being a rewarding experience. So, well, let's first start with which are the the cases in where we usually recommend egg donation. Um, this is the concept or what it is, egg donation. I think I've already mentioned some of it, and it's summarized. Instead of using your own eggs, we will be using eggs of a donor for the treatment. And the conditions that in where we recommend egg donation are one of the most common ones, as I said before, is maternal age. Usually, when you achieve certain age group, your egg quality comes down significantly, and this is a reason for not having successful treatments, especially when you're over 40. So using the egg of somebody that's young will allow you to have better quality embryos, and this is why this is one of the most common situations in where we recommend egg donation, especially after failed treatments. The other one is premature ovarian failure. Sometimes there are younger patients that actually can have a lowerage of their ovarian reserve in very early stages. And we see sometimes patients that are even below 35 years old and they're already becoming menopause. So in these cases, despite the age and because of the low ovarian reserve, egg donation is one of the options. The other is egg quality. Sometimes there are also younger patients that, despite being in younger ages, their egg quality is not good, and they go over several cycles of treatment without being able to have good quality embryos, or without even being able to create embryos. And despite being in younger ages, well, in these cases, egg donation is also an option. Also, we could have some genetic reasons, and there are cases in where in the family there are some important genetic diseases that want to be avoided to the offspring, or there are some personal genetic disease as well. So in these cases, if you want to go to a safer route, egg donation also can be an option. So here in ReproMed, what are the options or the kind of egg donation programs that we have? So we have three. One is egg donation at home. The other one is egg donation home plus. These are called home. Basically, it's because the storage of the embryos and also the embryo transfer will be done here in Ireland. And then we have another option that is egg donation abroad, in where most of the parts, some part of the treatment, at least that the crucial part that would be the embryo transfer and the storage of the embryos, would be done abroad. And basically, the reason why it's done in different ways is because Ireland has a very specific legislation, and the legislation goes around the non-anonymous legislation. This means that the individual that is born through this kind of techniques has the right to go to investigate its genetic origins. So as Ireland has the same legislation, we need to engage with a type of egg donation or egg bank that has the same type of legislation. So only in these cases in where there is similarity in the legislations is when we are able to bring the embryos that are made out of that country. They can be brought to Ireland and they can be stored here because the legislation in that country is the same as here. In the cases in where the egg donation program is done abroad, it's because the legislation in that country, that in this case is Czech Republic, is different than ours, and it's about the anonymous legislation. This means that there's no kind of information that can be shared about the donor. When I'm saying about the non-anonymous legislation, it doesn't mean that you're going to have the details of the donor or the donor is going to have your details. It's just that just in the case in where the baby that then it's going to become an adult wants to go over its genetic origins, well, he can have the access to that information. But before that, there's no kind of contact. As you have seen, well, both programs, I've been talking about both programs being held mostly abroad, and here in Ireland, there's no Irish-based egg banks, and the reason is because Irish population is small. So we need to do agreements with egg banks that are based in other countries, and this is the reason why we engage with these kind of treatments abroad. So we have agreements in the at-home program with an egg bank, a fertility clinic, and an egg bank that it's called Ovumia, that it's based in Finland. And again, Finland has the same legislation as Ireland. So what it's done, how the journey is done is that you have first the consultation with one of us, one of the consultants here. So we advise you on all the process, on all the patients, all the details about the treatment. We also go on your specific medical condition and see if there's anything you need to do before stepping forward into this type of treatment. Then once you guys decide that you want to proceed with the process, um, then you meet our egg donation coordinator. So this department will be in charge in guiding you through the rest of the process. Ovumia, as well as the other fertility clinic based in Czech Republic, that is ISCARE, that we will go through that later. They are both part of a large fertility holding that we belong also, that is Future Life. So we are part all of the same group. So the communication between the clinics is very straightforward. So this gives us, let's say, an additional advantage when you're going through egg donation program with us. Then after this, the next step is to sign consent forms and then to do the sperm freezing. So the male partner freezes the sample here, produces the sample. The sample is sent over to Finland. It can be frozen in any one of our clinics in Galway or Dublin. Depending on the profile of that sample, you can meet some criteria for certain type of guarantees, because depending on the program that you choose, you can have some guarantees that are related with the number of embryos that the minimum number of embryos that at least you will be able to have after going over the process. So with the Home Plus program, for example, you have a guarantee of 3 embryos. But that depends on how your sperm condition is. Then after this is done, the donor recruitment and matching process is done in Ovumia. So they'll start looking for a donor that basically the matching criteria is based on the physical characteristics, and usually they will be the same type of phenotype as you, same color of hair, skin, eyes, and these are basically the things that are taken in mind to match a donor with you. So once the donor is available, and the donor, of course, has passed through all the process of selection, you know that all over Europe, all donors go into a rigorous process of selection to see if they're really able to donate eggs. And that process involves study of their uterine anatomy, of their ovarian anatomy, also about their general health. Also, bloods are done to see how their cycle is. Also, they are screened for sexually transmitted diseases. They also go through testing of being carriers of certain genetic diseases. So this is what's called carrier testing. And then finally, they're also assessed psychologically to be sure that they are mentally able and that they are very aware of what they're doing. So only after going over all this process is when, and going over the process in a satisfactory way, is when the donors are ready to donate eggs. So when a donor is matched with you, is because it has already passed through all that process. So once you have the donor, then you will be notified on when the donor will start the stimulation and when it's going to be the egg collection of the donor. Once this is done, you will be notified on how the embryo development went, and finally, how many embryos resulted out of this cycle of treatment. Once the embryos are available and frozen, the embryos would be shipped back to Ireland. The shipping from Finland to Ireland is done once a month, and it is the embryos will always arrive to ReproMed Dublin, even for the Galway patients. Then once we have the embryos is when we can start the frozen embryo transfer cycle and the endometrial preparation to have the embryo transfer at the end. That this embryo transfer in the Ovumia's program will be done in ReproMed Dublin. And again, it's just preparing the endometrium with oral medication initially during 2 weeks. And then after these 2 weeks, just starting progesterone, and 5 days after starting progesterone is when you would have your embryo transferred. You know, there needs to be a synchronization between the time you're over progesterone and the age of the embryo. So as the embryos are usually frozen in day 5, well, this is the time in where you will have the embryo transfer. Then talking about the egg donation abroad, well, before we were talking about the Ovumia program that is again based in Finland. And now when we talk about this option, as I said before, just mentioned, is our partner is based in Czech Republic and is a renowned fertility clinic that's called ISCARE. It's also part of our group of Future Life. And just last year, for example, they performed over 1,000 IVF cycles for local patients and for patients abroad. So it's a very busy clinic. It meets very good quality standards. It has very modern facilities and also technology in their labs. So success rates here are very good. And they are very keen to give patients an excellent service. One of the advantage of this type of program is that waiting lists are probably a lot faster than what they are with Ovumia. In the Ovumia case, from the time in where you have sent the sperm and the time in where you have a matching donor, it could be like around 2 months to 3 months. Sometimes here in ISCARE, the process just take weeks. Okay, so this is one of the advantages. Of course, in this case, as it is explaining again, as it is an anonymous, Czech Republic has anonymous legislation. This is the reason why, in this case, you need to go and travel there once the egg collection of the donor, the date of the egg collection is given to you. And especially, you would need to go there for the embryo transfer, because in this case, embryo transfer is not done in a frozen mode. The embryos are not frozen. It is done in a fresh mode. So you will be notified with enough time when this approx is going to happen. So you would need to be there just before the embryo transfer dates. So you will be already prepared here in Ireland with us in ReproMed. And then once everything is ready and we have the egg collection date and we have the embryo transfer date, then is when you would be traveling to Czech Republic. So usually the time that you would need to be there could be just days. Okay, that could be between 3 to 5 days or probably less. So the time that you need to be there is not so long. The other thing is that as same wise as with Ovumia, previously the sperm sample is sent to the ISCARE clinic, and they also have a guarantee criteria that you need to meet in the sperm profile. And if you meet it, then you'll have a guarantee that is for at least 2 embryos to transfer after going through the process. So it is also a very good guarantee. As the legislation is different, again, the embryos would be frozen and stored there. So if, for example, you go through a treatment and you achieve pregnancy and you have more embryos, and then afterwards you would like to go for the transfer of those embryos, you would need to travel there again to be able to have the embryo transfer. So this is how it would be done with them. Are there age restrictions for donor egg treatment? Well, for example, in the case of Ovumia, the restriction regarding age is that you need to have done embryos before you become 47 years old. So with the Ovumia option, the age limit is more strict. And with ISCARE, as per legislation, they accept you before you become 49. So these are the age limits that you need to have before having the embryo transfer. Can I meet my donor in advance of the treatment? As I said before, not even in the non-anonymous legislation, you will be meeting the donor, and even less in the anonymous legislation. That is what happens in Czech Republic. So this is a process that goes completely in an anonymous way, and only in the case of Ovumia is when the offspring can contact donor, but in the future when this baby becomes an adult and wants to do so. So it's just in the Ovumia option. Here it's not possible. What information do I get about the donor? Well, you will be filling a donor recipient criteria, and you would basically take for the physical characteristics that you would like the donor to have. And as I said before, it's basically related with the phenotype, color of hair, height, color of skin, eyes, all that. So then is when they will be using this information to do the matching with the donor. And same wise is what will happen in Ovumia. What is the time for an egg donor? So as I said before, the time frame with ISCARE is 2 to 3 weeks. In the case of Ovumia, it could be between 2 to 3 months. All right, so that's the difference. Probably the reasons for the delay with Ovumia is that probably finding donors in the non-anonymous with a non-anonymous legislation is not as easy as when it is anonymous. But again, probably if you think about it, 2 months, it's not so much as well. How many embryos will I have? We talked about the guarantees depending on the program. With ISCARE is at least 2 embryos if you reach the criteria. And with Ovumia, depending on the type of program that you choose, you can have even up to 3 embryos as a guarantee. If, for example, in the first cycle, it's not able to achieve this minimum number, then another cycle would be offered free of charge to achieve the number that was agreed as a guarantee. So why choosing us? Well, as I said before, we have strong relations with the clinics we are dealing with. We belong to the same fertility holding. There's straightforward communication. So things go really a lot easy when it is that way. And then on the other hand, we have the experience of dealing with this type of programs, not only the lab, but also our consultants and our nurses are very well informed on how this goes, and also we have an egg donation coordination team that will be in charge just of these type of treatments and will guide you through the process. So there is a lot of advantage. Also, we have the license to, in the case in where you want to bring your embryos here to Ireland, we have the license to store them here for you with the best standards that we have available in the reproductive field. So I think that we offer you these great advantages. All of us, all of our consultants are very familiar with this type of treatments. They all have a vast experience of years in the field, and we also will guide you with a sensitive way to approach this kind of situation that probably at the beginning, as I said, could be difficult, but I think that in a sensitive way, we can help you to go through this process and finally have the best information and criteria to decide if at the end this is the option that suits you. That in my personal opinion, I think that usually it is a very good option, and this is why I like to call it the winning card, because it has all those advantages that I mentioned before. So just as a final message, what I would say is that usually it's probably sometimes difficult to step up and to finally take the decision. But what I've seen so far in my 16 years of experience is that usually after taking that decision and crossing that door, usually the outcome and the satisfaction that you will have at the other side of the door is a good one. So if you guys are interested in having more information, in seeing if this option is the best for you, please just contact us, arrange a consultation with one of us, and we will be very happy to guide you through the process. So well, now thank you for being here, for taking in all this information. There are some questions that they have done through the process. So let me check on the questions that I have here. Wait a second. There are some questions around here. Okay, so one question is, does flying affect the chance of pregnancy after transfer? So this would be in the case in where you would be doing the treatment abroad. And You know, as we have this program, there's lots of clinics around the world that are doing treatment with patients from other sides, other countries, or other parts of a certain country. So they need to travel, they need to take flights. And what has been seen so far is that just flying is not something that will affect your success rates. Of course, probably flying the same day could be a bit stressful, the same day of a treatment. So what I would advise is to be there 1 day before the procedure, the embryo transfer, and then take that same day of the procedure to rest, and then the next day to go back home. So just as a minimum time frame to do things, you know, in a stressless way. Then how long do I have to stay in Czech Republic? Well, I just said probably advisable minimum 3 days. It could be more if you would like. Sometimes there are some couples in where the male partner needs, because of its sperm profile, needs to do uh, produce fresh sperm sample on site in ISCARE. So in that case, you probably need to travel beforehand. But usually it would be like around 3 days. Then there's something here that's saying that, what would be the advantage of doing the egg donation here in Ireland? Well, the advantage is that probably it's less stressful because the embryo will arrive here and you will be doing the whole treatment here. So probably you won't need to travel abroad, and this could be less stressful, probably. But again, even if you need to travel, things are arranged with enough advance time to be able to organize things. The other advantage is that the embryos would be stored here, and if you have remaining embryos out of the treatment, you wouldn't need to travel anywhere. You would just come to the clinic and have your other embryos transferred. So as I said before, the journey with us usually is a smooth one because we don't only have the experience, but we also have a department that is dedicated to this type of treatment. So this is what I would say is the most powerful advantage in our case. So, well, just hoping this information session was useful, and just hoping that if you're interested, well, just don't wait more and contact us and make your first appointment. So just we'll wait for you, and we'll take care of you here. All right. Thank you so much. Take care.